Welcome to today's EMN 5. We're going to talk about the 5 H's and T's of cardiac arrest. So, when you have a patient who is in a pulseless arrest, you're going to think through the 5 H's and T's, which is this little green box down at the bottom. Basically, it's a list of things that might be contributing factors towards the arrest and things that you can actually treat to try to get the patient back again. So it's a good differential to go through as you're running the code. So I'm going to go through the H's and then the T's just briefly, and then I want to give you kind of another method of thinking through this differential just because I think it's a little bit hard sometimes to come up with the H's and T's since they all start with the same letter. So we'll go through that at the end. Okay, so first on the list of H's is hypovolemia. This can be from poor intake, sepsis, blood loss. Your treatment is going to be giving fluids, maybe blood products, and obviously a big part of it is going to be getting IV access or IO access very rapidly. Next up is hypoxia, usually from respiratory failure. Treatment here is going to be oxygenate, ventilate them, get a good airway right away, see if you have equal chest rise. Next up, we have this hydrogen ion. I think that's cheating a little bit. Basically, acidosis. This can be from respiratory failure, from buildup of CO2. It could be from an ingestion or a toxicity, or it could be from something like DKA or AKA. Those are really common things. So things here to think about when you're treating. First, you need to see if you have it. So make sure you get a blood gas and try to hyperventilate them. Try to have them breathe off that acidosis. And then think about possibly giving bicarb. It's one of those kind of plus minus treatments. Something to try if you're in a code. Next up is either hypo or hyperkalemia. It can be either of these. Common things with this is if it's a dialysis patient. If you see fistulas or a dialysis catheter, this should be first on your list for a patient who's in a code. On your EKG, you can look for peaked T waves, U waves, YQRS. Obviously, try to get some labs to help diagnose this. Your treatment is going to be insulin albuterol, sodium bicarb, and calcium. Hypoglycemia is pretty basic. Just make sure you get a point of care glucose immediately. It's one of those good vital signs. And if you're concerned, give the patient an AMP of D50. Lastly, we have hypothermia. This is unfortunately usually from an exposure injury, and your major treatment here is going to be either passive or active rewarming. Okay, here are the T's. Let's go through these really quick. First one is toxins. Most common toxins to cause an arrest are calcium channel blockers, beta blockers, digoxin, TCAs, and cocaine. Here you're going to look for EKG changes. Hopefully you have any signs of history, or maybe the families around it can tell you that maybe they're concerned. And other things on exam, obviously do kind of a skin exam, pupil exam. Think about mostly supportive care for these patients, unfortunately, although there are some antidotes with some of these toxicities. Tamponade is usually from trauma, so it's cardiac tamponade. Other things can be an aortic dissection. Malignancy and pericarditis may be probably not as common to collect as quickly, but obviously if you have that on history, definitely put that on your list. Things to look out for here are JVD, muffled heart tones, like I said, a good history. And then our treatment here is basically pericardiocentesis. This is one of those things on the H's and T's that there is really something you can do to help this patient out, and that's the pericardiocentesis. Next up is tension pneumothorax. This is probably most commonly from trauma, but think about it maybe iatrogenic, like if you've recently put a central line in a patient in the ICU or in the ER, or a ventilated patient that's crashing. Here, you're going to look for on signs of exam JVD, difficulty ventilating, unequal breath sounds, and what you're going to do for these patients is a needle decompression and then eventually put in a chest tube. Thrombosis is referring to either coronary or pulmonary, so basically either an MI or a PE. Basically, you're going to take them immediately to the cath lab after you have ROSC, or maybe even before, depending on your cath lab, and maybe consider thrombolytics. If you're very concerned for pulmonary embolism, you shouldn't just be giving thrombolytics to any patient who's coding. And lastly is trauma. This should be fairly evident from your basic primary and secondary surveys. So there's our H's and T's, just to summarize. And like I said, I want to kind of go through one other way that we can really think of this. So one thing I think about when I'm standing in a code and I'm in that 2-minute sequence and I'm kind of waiting for the next things to happen is you want to think through your differential. So one thing I like to do is you kind of end up scanning around the room. Well, first thing we're going to look up the monitor. What kind of things on the monitor are going to cue you into some of those H's and T's? So what are you looking for there? Good. So you're going to try to get a blood pressure. That would be hypovolemia. O2 is going to indicate hypoxia. And make sure you get a temperature. Really important vital sign to look for hypothermia. Okay, now we're going to obviously draw some labs. What kind of things are we looking for in the labs that were on the H's and T's list? Good. So we have glucose. So we're going to get a point of care. We're going to look for hypo or kalemia. And also make sure you get a VBG or ABG to get a pH, which would indicate acidosis. And then lastly, I want you to think through two organ systems. So that's the heart and the lungs. So for heart, we have either acute MI or tamponade. In the lungs, you have two problems. Those could either be clot, PE, or tension pneumothorax. And lastly, just looking at the whole body, I think of my last two H's and T's, which is going to be trauma, and then toxicity, which really affects the whole body. So that's another way to think about your H's and T's. Here's some references, and thanks for joining us on EMN 5.